Welcome back. Dr. Natalie Gonzalez here, and we're going to go over some of the most common signs and symptoms of heart disease. Before we get started, I want to let you know that if you have any of these signs or symptoms and you haven't been evaluated by your healthcare provider, then this is the time to do it. If you are having chest pain or shortness of breath with these signs and symptoms, you need to call 911. So just getting started, I was going to do 10 of the top signs and symptoms of heart disease. And what I realized when I started was that the first 5 on my list were all related. So we're going to do those in addition to another 10. So there are lots of different signs and symptoms of heart disease, and they are things that we should all know since heart disease is the most common cause of death in the United States. Another interesting fact, though, is that in a large percentage of people who actually die from heart disease, sudden death is their first sign. So if you have any of these other more subtle signs and symptoms, it's really the time to make sure that you get evaluated thoroughly by your healthcare provider. The first one I would want to talk about is chest pain or pressure as being a symptom of heart disease. It can be chest, that's the most common one that people think of, but it can be anywhere in the head and neck, shoulder, and abdominal areas, even the back. So it can be located in the back of your neck, in your jaw, anywhere in the front of your neck, across your chest, shoulders, arms. It can be left or right-sided. It could be belly pain. And the last one that I think of is between the shoulder blades. That's another common location of pain or pressure that can be related to heart disease. And pain and pressure just signal to you that your heart is not necessarily getting enough oxygen. Either the vessels are narrow and the blood can't get through them with the oxygen, or maybe you're getting less oxygen through your lungs and that's affecting your heart also. Or thirdly, it could be that your heart needs more oxygen because of something you're doing like running or digesting or just increased activity, and your heart is not able to get enough extra oxygen for that particular activity. Heartburn can be because the heart, again, is not getting enough oxygen. And it's an easy one to ignore because we think, oh, it's just related to something I ate. But it gets missed because we think that way. And if you have something like that going on and you haven't been evaluated for heart problems, make sure that you see somebody about that. I would say the next most common one that we see is shortness of breath. Shortness of breath can also be a sign that your heart is not pumping well or getting enough oxygen. And sometimes people will mistake this for maybe their asthma has gotten worse. My brother did that. He thought that because he was wheezing, it was just that his asthma had gotten worse. But wheezing and shortness of breath can be a sign of heart disease. And both of those are things that should be checked a little bit more thoroughly. Just the fact that your heart is deconditioned and you're not getting enough oxygen and blood flow to it is an early sign of heart disease. And it should at least be evaluated by your doctor to see if there's something that you can improve. And we'll have lots of ideas for things that you can improve for all of these areas of heart disease as we go along in these next few videos. Another very common sign of heart disease is swelling. Swelling of the ankles and feet and legs especially. Swelling in your ankles and feet is a signal that your heart is not pumping blood flow to the rest of your body all that well. And it's backing up is what it's doing. And that's why you get swelling in your feet and ankles first, and then maybe your lower legs, usually in areas where the the extra water in your body is pooling in a downward direction from gravity. So if you're someone who sits in a chair, you might be getting swelling in your butt. If you're someone who's lying flat on your back, you could have swelling in the back of your arms or elbows, as well as anywhere on the back of your body. When you get swelling and you're somebody who's up and around, most of your swelling is going to go down with gravity, and so it will be located in the feet and ankles. And it can just tell you that the heart is not beating as strongly, and because it's more sluggish and it can't push the blood forward into your body, it's backing up a little. Another very common sign of heart disease is related to the electrical system of the heart, which is also related to oxygen and blood flow to it. But the electrical system of the heart, when it's not working well, will give you irregular rhythms or heavy pounding in your chest, or maybe a rapid fluttery feeling in your chest. Those are signs that your heart is not beating as regularly, and there can be a lot of different electrical patterns that are irregular that cause what we call palpitations, which is a heavy thumping of your heart, or irregular rhythms, which we call arrhythmias. And so those are signs of heart disease also. And I want to talk about high blood pressure. High blood pressure is a type of heart disease, generally because it signals that we have vessels that are maybe a thicker wall on them, and it causes increased pressure in your heart, and the vessels leading to and from the heart will cause a thickening of the wall of the blood vessels, but also a thickening of the wall of the heart itself. And that can also be a sign of heart disease, and it can progress over time to causing other problems. But heart disease, when you have thickened vessels, you tend to also have narrowing of those vessels also. So you're not getting as much blood supply to the areas of your heart or the rest of your body that need to have that blood supply and oxygen. There's another sign of heart disease that I think is really important to know, and that's decreased blood flow to different areas of your body. When I was younger, in my early days of working with a doctor, he was a general practitioner who worked in a very small town in Maine, and he was of the old school. And one of the ways that he determined whether somebody had heart disease was to check their blood vessels, to check the vessels of the body to see if the vessels to the feet and the ankles showed signs of narrowing. Then he could expect that the blood vessels to the heart also had narrowing, because all of the vessels of the body are related, and what's happening in one area is likely happening in the other areas of the body, whether it's the heart or the brain getting less blood flow. So just looking at your feet and ankles, and the first thing you do is look to see if you're missing the hair on your lower legs, because when the hair starts to go away from your ankles and your shins, it means that the blood flow is less and the vessels are probably more narrow. And then to check the pulses in the feet and ankles. And if you can't feel them, or if they're very faint, it also signals that there may be narrow arteries to the lower legs, but also to the rest of the body, including the heart. So if you have cold hands and cold feet, check those signs in your legs to see if you might have narrow vessels to your feet and ankles. And if so, you may also be dealing with narrow vessels to the heart, vessels that are smaller and can't carry as much blood flow and oxygen. Decreased sensation to the feet is also a sign of just numbness and tingling in your toes and feet, and also just not being able to feel things as well in your feet is also a sign of decreased blood flow to that area, and can also be a sign of heart disease too, because as I said, what's happening in the feet and ankles is also probably happening in the rest of the body too. And I want to mention, you won't be able to notice this, but your eye doctor has the ability to look at the vessels at the back of the eyes, and that can also tell you whether somebody has signs of heart disease, because the vessels of the back of the eyes will also be an indication of what's happening in the rest of the body. So those would be really important things that you might ask your eye doctor when you go to have your eyes examined, is whether or not he or she can see any problems in the vessels of your eyes that indicate that you might have heart disease. So lots of things to look for when it comes to heart disease, and just to be aware of it, if you think you are someone that might benefit from this, or if you know someone who could benefit from some of these videos, we're going to be teaching you ways to not only identify whether you might have a problem, but we're also going to be teaching you ways to be able to deal with that. And in fact, I believe that the studies that I've read, there aren't very many of them, but they're really promising, really very hopeful studies that show us that people with some of the worst heart disease have been able to reverse it. And that's what's really exciting about this field. Okay. All right. If you have any questions, leave us a comment, like and subscribe, and we'll see you in the next video.